Just a couple of final slides here. I'm just going to reiterate what I talked a little bit about earlier about why I think it's so vital that we look at things other than mental health delivery and specialty mental health settings. From the large scale, very large scale, and the definitive study still, the epidemiological catchment area study that Manderscheid and colleagues did first in the 90s with a series of updates since that time. At this point, in 2009, these data were a couple years before then, I think 2006 or 7. 50% of all mental health care is now delivered in primary care settings. It's a tremendous shift away from specialty mental health care. The proportion of individuals who receive any kind of mental health care increased from 12 to 20% of the entire health-seeking population. Interestingly enough, what about that range of numbers jumps out at you? Anything spark an association there? 12 to 20% of anybody who goes to see a healthcare provider now goes to see that person for a behavioral health concern, in addition to the other things they're being treated for. What is the incidence of depression in the U.S. population, in general terms? Right around there, 17, 20%. We can argue about the exact numbers. What does that suggest? I think it suggests that the population is becoming more aware about the availability of effective treatments, and those people who are suffering from conditions like depression realize that they can seek assistance for them. This is actually a good news little slide bullet, I think. I think it's very nice. Those people who got mental health care in medical settings only, i.e. in the primary care environment, no specialty mental health, that number increased between 1998 and 2003. That's the range on these data, 154%. And of those people, those treated in community health centers, those federally qualified health centers I talked about earlier, for either mental health or substance abuse issues, increased from 210,000 annually to 800,000 annually. Tremendous increase, tremendous increase. We don't have the providers we need placed in those community health centers to deal with increases like this. It just doesn't happen. Okay? Another reason why we have to be very, very concerned about how we provide our expertise where our patients really need for us to have it provided. We've got some challenges, unfortunately. And one of the big challenges that we're facing right now is there seems to be a little bit of donor fatigue, if you will, amongst granting agencies to investigate mental health issues. And there are about 9 or 10 foundations. The California Endowment is one. Robert Wood Johnson is another that provide much of the private funding for research into basic and clinical investigations for mental health problems. That number has decreased rather significantly over the past decade or so, and it is now reduced by over a third from what it had been in the past. That's a problem because these, not only do we need money for basic and clinical research, but we need a lot of funding, as Dr. Morales will talk to you about, for training of appropriately educated workforce in behavioral health care.